Pfizer wants the Food and Drug Administration to authorize the Omicron booster shot for kids ages 5 to 11. The company submitted an application to the FDA seeking the authorization of its bivalent COVID booster shot for children in this age category. According to The Hill, Pfizer's bivalent boosters currently only authorized for use in those 12 and older. Now, per the report, this request comes only days after Moderna requested FDA authorization to administer its updated Omicron booster to children as young as 6.
NBC reports at least 4.4 million people have received an updated COVID booster since the start of September, according to data released last week by the Centers for Disease Control and Prevention. That number represents only around 1.5% of people currently eligible to receive the shots in the United States. However, the CDC said the data does not include people who received updated Pfizer BioNTech boosters in Idaho and Texas. So it's interesting, right? You know, there is an effort to make the boosters more accessible, and certainly there are people who probably have children in the groups for which the booster is not currently authorized who want to get that. However, the numbers of people overall who seem to be availing themselves of the booster is relatively low. And I'm curious whether or not this is an indictment of kind of the Biden administration's messaging around the efficacy of boosters, or whether it's a scientifically backed and sincere understanding of the limited application of boosters for a lot of folks who have already gotten COVID, had COVID recently, and in fact maybe recommended against getting boosters because they have had COVID so recently.
Right, because it's too recent to their protection. That's why I initially didn't get the booster, because I'd had COVID, I'd had Delta about 4 or 5 months after getting my initial shots. So then I put off getting a booster. I am going to get one tonight. I'm getting the bivalent shot. A lot of people asked, a lot of people comments, people have messaged me saying, what is your, because I said on the show yesterday that I was going to get it. And I saw a lot of RIP Robby, gonna die of myocarditis. But look, I think for myself, I'm prone to respiratory illnesses. You've seen me this summer. I've been ill a lot, and so I absolutely agree and understand with things that people we've had on the show have said, like David Zweig saying that if you look, you're not seeing in the data a tremendous benefit here, nor really a tremendous harm. Though I don't expect that it is going to make me any less likely to contract Omicron, and maybe it's not going to have much of an effect, but I don't think there's really a risk of it for me. So if there's even a small chance that when I do get Omicron, I will be a little less sick than I would be otherwise, I feel like I will make that choice, given that I have to show up to this job every single day. I got to sit in this chair next to you. We got to power through it when we're not feeling well. Really, my priority is to be sick for the shortest amount of time. Again, I am not saying that this absolutely accomplishes that, but I would take that chance in the same way that I'll get the flu shot, and I'm getting the flu shot as well.
Hero stuff, Robby. So I for one, appreciate the solidarity.
It's really for you, Briahna. It's really for you.
It's the best gift you could have ever given me, Robby. But look, it is a really interesting thing, because I was talking to some folks who had called into my call-in show last night who were healthcare professionals, and it was an interesting conversation, because from their perspective, they see the shifts again, away from masking, voluntary masking, even among people who might have philosophically supported a mask mandate, themselves are eating inside. There's less cultural pressure to mask. I feel it myself.
Eating inside, the audacity. No, but no, I know.
The inconsistency of having eating inside has made people think, well, if I just sat in this restaurant, then why would I mask later in an Uber, an elevator, or wherever else? And I think that is both understandable and also not necessarily scientifically valid. If you did just eat in a restaurant, maybe it is good for you to be masking in a space, in an enclosed public space with someone else who has been taking different kinds of precautions, or also just because you took a risk in one place doesn't mean you should just serialize that risk as though that they don't accumulate over time. Your exposure doesn't accumulate over number of risk-taking behaviors you engage in. But what he was saying was, what two of them were saying was, they are seeing rising rates of COVID in the hospitals and rising rates of people one person in particular said that their experience of Omicron wasn't that it was less fatal, less lethal, that they were seeing a lot of really dramatic cases even now. And I was reflecting on how so much of the rhetoric earlier in the pandemic was about, well, okay, even if you don't care about getting COVID, you don't want to get so sick that you are burdening our healthcare professionals.
Sure.
And so much of that rhetoric has largely dissipated. And I wonder, what you make of that. And if we really did see a demonstration of hospitalizations rising in a way that was clearly putting a damper on our public health system, whether that would affect your feelings about whether or not masking was appropriate outside of the context of a literal mask mandate.
Sure. Well, that was the argument that persuaded me for the initial shutdown of everything. The health officials said, you know what, we are just not prepared for this, and our hospitals are about to become overwhelmed.
Yeah.
And once we have something in place to deal with this, then it'll be different. So it was really the preventing of hospitals from being overwhelmed, from having to do triage care where where doctors are making like split-second decisions about who is worth saving. That was the argument. That actually, even more than people are going to die, because obviously we weren't going to do this. People were going to die of this. It was not preventable. The hospitals being overcrowded was the argument for having a broad temporary shutdown of society. So yes, I think certainly hospitals being overrun is a good argument, a good indication of the pandemic not being over. Now, my understanding, however, though, is that in most places, the overwhelming amount of places, the hospitals are not being overrun. There, some places, when they're experiencing more serious outbreaks, are experiencing upticks in cases in the hospital, but
things like high nurse turnover, the nursing deficits that we've seen. They're struggling to get people to seemingly to stay in these jobs, and they cite the conditions that they're in. I mean, what do you make of that?
Is that a COVID thing, though? That's burnout from dealing with COVID patients?
I think that's a big part of it. Now, I would certainly advocate for nurses to have broader support, even outside of the context of COVID. They were overburdened and understaffed and things like that. But in their telling, the COVID pandemic, the lack of support, the incredible hours, the lack of pay, has taken
I also
toll.
think we now see a lot of people, because Omicron is so contagious and so transmissible. You do, and I'm not trying to say it doesn't cause severe disease sometimes, because it does, but we do see more people who are hospitalized for some reason, and then it turns out that they have COVID, because it's so much more likely to just have COVID, where it's not really the primary reason for them. It's incidental to them.
Yeah.
Also, we want to discuss some interesting data. So there's new data now showing that infants ages between 0 and 5 months have joined a relatively higher risk category for COVID-related hospitalization. So you can see this interesting graph here over time. So the very top, the green line, is the most at-risk people. That's 65 and older. But by the end of the graph, the 0 to 6 months group is in the third most category. So they're more at risk, more likely to be hospitalized than people, I believe, like ages 1 to 50. And then people older than that are still more at risk. If you look at some of the other graphs, part of it is that the risk for the elderly has come down substantially. So it can look like, as that risk shrinks, it gets more proximate to the risk for all other groups. But it's still a good thing, because it's just an equally low risk. But among that lower risk, now there have been, which I imagine is a couple standout cases. I really don't know what's going on there. It'd be important to take a closer look at it, because that would be scary. Obviously that's people's babies. That's a group that can't get vaccinated. I don't think under any vaccine paradigm. So definitely something to look out for.
Yeah, well, we will be keeping an eye on that and other emerging COVID trends. And tomorrow on Rising, we'll have even more incredible content for you.
Be sure to like, share, and subscribe so you never miss any of it. And for those who like to listen on the go, we're now available anywhere that you consume podcast and podcast-related content. And we will see you all back here tomorrow. Again, unless the vaccine takes me out, then everyone can say they were right.
Don't even put that out into the ether, Robby. You'll be fine.
See y'all tomorrow.
See you.